So my first question is pretty simple. What is COVID-19 and how has it impacted us at such a level where the world is basically shut down? And then what's next?
Right. So one of the nice things about living in 2020 is that there's this incredible amount of information that's available to everybody through the internet. I think most of you know that COVID-19 is this unusual virus that we think came out of China, presented there. And it's related to some viruses that we already have in the United States that are called human coronaviruses. The COVID-19 is thought to have come from an animal species, and it has jumped into the human population, and it turns out it's pretty infectious for us. So I think most people are familiar with the facts of how it spread over the last 6 months from China throughout the world, and now very intensely in our own country. The other facts that I think most people are aware of are how it has spread and how that's changed our society as we try to respond to it. The virus is a respiratory virus, and it may also infect the GI tract, but it appears that the respiratory tract is the main site of reproduction, both in the upper airway, which includes the nose and sinuses and throat, and the lower respiratory tract, which is down in the lungs. And it's most problematic when it gets down into the lungs and causes pneumonia, but it has other features. It can cause diarrhea and GI illness. It's been known to cause cardiac heart problems, particularly in adults. But we're also just now learning this weekend that it can do it in children as well, very infrequently. It has caused some immune reactions in children that have put them in the ICU, but for the most part, they're able to recover from that. That typically occurs 2 to 4 weeks after an acute episode of COVID-19. The other things it can rarely do is cause some encephalitis, which is sort of a brain disorder. Again, tends to be transient and passes most of the time without terrible complications. So it's like a lot of viruses that we deal with. It's got a lot of different manifestations. It has its most common manifestations, which are sinus, cold, and sore throat symptoms, fever, achiness. And it's got a couple of unusual things. One is the profound fatigue that you get with it that seems to be on par with what some people experience with mononucleosis. And the other thing is this weird sort of observation that people lose their sense of taste and smell. And that's a very unique feature. And if we encounter that in a patient, we kind of assume that this is probably COVID-19 disease even before the test results come back. So anyway, the other really important thing for this discussion is who it impacts. And we have learned that unlike almost every other infectious disease, this one tends to spare children. We think that's because the virus enters the body through certain receptors that are not very prominent during early childhood and even into early college years. And as a result of that, the virus has a hard time attaching and penetrating the system. So most children do well. There have been rare fatalities associated with this, and we think in many cases those are really related to children's other underlying diseases. But most of the time kids do well. They are uncommonly hospitalized. We've had very few hospitalizations in Arkansas. We've been tracking that very carefully through all the children's hospital groups as well as other hospitals. And all of those kids have done really well. We've had a couple go to the ICU, and that's it, without complications. So that's a really important piece of information. The second one is, and I'll stop, Jerry, because I know this is becoming a lecture instead of a conversation.
Actually, it works out really well for Miss Cook and me that we just sit here and listen. That's great.
The other thing is, because children have a hard time contracting the virus, they also have a hard time transmitting it. And even though there's some data that suggests that the virus counts can be as high as we see in some adults, the evidence is that they very rarely transmit. So we don't know exactly why that is. Maybe it's because kids are smaller, they don't cough, they don't transmit the virus through the air as effectively, or maybe they just have lower numbers of viruses at the time when they're having contact with other people. We really don't know the whole story. But the evidence so far is that it's uncommon for that to happen. And the evidence comes from three large bodies of data. One is out of Iceland, where they tracked the genetics of all the virus infections there. They were only able to document a transmission of 2 adults that acquired infection from kids out of their entire population there. The other group is out of New York City, largely data that came out of daycare studies that show, again, a child may get infected at home, they may go to daycare, but they don't transmit it very effectively to other children. And they don't transmit it to adults very well either. So this is a really critical point that we'll get to later on in the conversation, is that the people most at risk in schools from COVID-19 are really adults who work there, who transmit it to other adults who are working there. And that's really an important thing to think about in school planning.